have experienced this. So this is what we call edema. Yeah, it is a swelling. Usually it happens in the legs or in the lower limbs, but sometimes it can also affect the face, the hands, and all the other body parts. I'm going to address this issue only in pregnant women in this video. However, if you know that you're not pregnant and then you have this edema, consider checking your kidney, liver, or heart, and then other endocrine issues. Usually when women get pregnant, the volume of blood has to increase for about 50% from the amount of blood that they had initially. So this increases the blood capacity, and then the water retention will also increase. Number two, the hormonal changes that we have, because there's a hormone that we have during pregnancy called progesterone. It increases water retention in the body of a female. Yeah, so this one will also lead to edema. Then number three, as the uterus is increasing, yeah, olubutonga lugenda lukula, you compress on the vein. Most especially we have what we call the inferior vena cava. Yeah, when you compress on it, it will lead to, you know, some water and then some fluids to leave the blood vessels. Yeah, and then they will accumulate in the lower limbs. That is why usually we advise women to sleep on their left side so that they don't compress that vein. Number four is the hot weather. Yes, we have a hot weather, and then standing for so long, it can also lead to this edema. So these are the ways how we can prevent it during pregnancy. Number one, please rehydrate. Yes, take enough water, because when you take enough water, it flushes out the excess sodium in the body. At the end of the day, will reduce the volume of the blood. Then, like I've said, pregnant women should sleep on their lateral position of the left. Yes, they sleep on the left hand side so that they don't compress on the other vein that I've told you. Then avoid standing for so long as a pregnant woman. Don't stand for so long. And then, very important, elevate the legs. When you're resting, try to elevate the legs so that it increases the blood flow back to the heart. Yeah, it will also improve. Then if you see these things when you're having this edema, number one, when you get sudden swelling, that is number one, or when you feel pain where the swelling is, or when you experience shortness of breath with swelling, contact your doctor as soon as possible, or go to the nearest facility and then get medical help. Yeah, thank you.